Professor, how are you? Are you online? Can you hear me? Doctor, how are you? Can you hear me?
Okay, thank you. Can you hear my voice?
Yes, we can hear your voice.
Okay, can you see my screen?
Yes, we can see your screen. Can you please make it full screen?
Okay,
Thank you.
Okay, thank you. Good afternoon, everyone. I'm very glad to be here to show my presentation. So my topic is about biomimetic hybrid membrane called 水同素 assisted with laser irradiation for efficient rheumatoid arthritis therapy. My name is Huang He Yu, come from Hunan University of Chinese Medicine. I will tell you this story, follow these 5 contents. Rheumatoid arthritis is a chronic inflammatory disease characterized by inflammatory cell infiltration, cellular hyperplasia, tendons formation, and bone destruction, which leads to disability in the worldwide. The incidence rate of RA is about 0.5 to 1.2%. The main treatment strategies for RA are inhibition of inflammatory response, inhibition the cellular hyperplasia, tendons formation, cartilage, and bone destruction. The classic drug used to treat RA are NSIC, corticosteroid, DMARDs, and biologicals. However, there are many adverse reactions in the clinical treatment of RA. The pathogenesis of RA, the NEPS CD4 cells release the interleukin-6 TGF-beta can stimulate the JAK-STAT pathway to stimulate the Th17 cells to release the interleukin-17 cytokines. Then the cellular cells, macrophage cells, cartilage cells, and the vascular cells and osteoclast cells can release interleukin-6, interleukin-8, TNF-alpha, interleukin-1 beta, and some inflammatory cytokines and MMPs, RANKL, VEGF to lead to cellular hyperplasia, cartilage destruction, tendons formation, and bone destruction. At first, we reviewed some anti-RA natural compounds, and we found that these compounds are mainly anti-RA by regulating the NF-kappa-B, JAK-STAT, PI3K, MMPK signaling pathway. Due to the lacking of ideal drugs, and the 2-JA ancillary medicine shows a good way to find a new and effectively and low toxicity effects to treat RA. 2-JA people get in Wuli Mountain. The climate in here is warm and humid. The 2-JA ancillary medicine is a very important part of medicine system in China. The category heticulata stones is named 血桐, an anti-rheumatic and arthritic herb in 2-JA ancillary medicine, which mainly contains biologically active lignans, terpenoids, and sesquiterpenoids. 血桐 possesses therapeutic effects in the terms of 2-JA medicine series, reinforcing wide energy, promoting blood circulation, expelling wind UV, and removing damp UV. At first, we published 2 papers for the anti-eye effects of Xuetong ethanol extract, and we found the Xuetong extract showed excellent anti-eye effect, and it can inhibit the bone erosion of arthritic joint and protected the joint against cartilage destruction and bone erosion. At first, we screened the anti-eye compounds into Jiaan's medicine Xuetong. We used IAFL cells and the cells to evaluate the compounds, the activity of compounds. And we found the tretinoid chisenectin E. We also named Xuetong Su showed good anti-RA effect. This structure. And we also found the IC50 value of SE was 9.12, which is the best anti-RA compounds in Xuetong. SE also showed no obvious toxic and side effect on normal cells compared with some anti-RA drugs such as methotrexate, indomethacin, and cinnamon. Then we did the in vitro experiment for anti-eye effect of Xuetong Su. This is the Xuetong plant picture and SE structure. We used the 3 cell line such as IFS cells, macrophage cells, HUVEC to evaluate the anti-synovial hyperplasia inflammation and angiogenesis effect by JAK-STAT pathway, NF-kappa-B, interleukin-20, interleukin-17 axis, and VEGF, HIF-1 And at first we found the IFS cells variability after treating with SE at the dosages 9 and 18 shows good inhibition of the cell variability, which promoted the apoptosis of this cell line in a concentration dependent manner. And the SE also markedly decreased the TNF-alpha, interleukin-1 beta, interleukin-6 expression in the liver, but increased the interleukin-10 expression in LPS-induced IFL cells or macrophages. SE also regulated the apoptosis pathway and the JAK-STAT pathway in LPS-induced IFL cells. It also inhibited the NF-kappa-B and inhibited the NMPS in LPS-induced macrophages cells and IAFLS cells. What's more, SE markedly inhibited HUVEC cell proliferation. The migration ability and angiogenesis of LPS-induced HUVEC cells after SE treatment was significantly reduced. Protein cell assay showed SE could remarkably inhibit the expression VEGF and HIF-1 Now we constructed the HRPS nanoparticles. This is an nano-targeted drug delivery system based on Xuetong Su. We also published this data in SS Nano this year. You know, nanotechnology and nanoparticles have a wide range of application in biomedicine. And nanoparticles with NIR can be targeted to reach the site of arthritis, inhibit synovial hyperplasia, and reduce bone destruction. Prussian blue, we also call PB nanoparticles, is certified by FDA, has a strong absorption in NIR region and covers a lighter energy into heat energy with a good biocompatibility and anti-inflammatory active. At first, we prepared a biomimetic hybrid membrane, used the RBC membrane and the FLS membrane to get the RFM. This is a functional membrane. We find the best RFM function was obtained under the condition 37 degree temperature. And we did also checked the biomarker on the membrane. Then we constructed the nano drug delivery system, HRPS nanoparticles. This is the skin of the construction. And we used the SEM and the TM and the SDS to characterize the nanoparticles form and the protein on the cell membrane. And we find the particle size around 121 nanometer. And this is the zeta potential, and UV, RR, XPS, XRD also was used to characterize the HRPS nanoparticles. Then we evaluated the photothermal conversion efficiency exploration of nanoparticles. We can see HRPS nanoparticles with a concentration of 0.1 milligram per milliliter exhibited excellent photothermal conversion efficiency and photothermal therapeutic effect on the irradiation power of 1 watt-meter NIR laser. This picture showed the good photothermal effect and stability in vitro. We can see the nanoparticles, HRPS nanoparticles can up to 52.2 degree. And then the loading and encapsulation and the release rate was also studied in here, and we find it release mainly more than in weak acid condition more than the normal condition, and the hemolysis and coagulation assays showed good biocompatibility of these nanoparticles. Then the nanoparticles showed no toxic of the normal cells. The RFS cells uptake rate of HRPS nanoparticles was about 6.96 times higher than that of PS nanoparticles and RPS nanoparticles treated groups, and it obviously escaped the liposome degradation. Then we did the anti-IA effect of HRPS nanoparticles in vitro. We used the IAFS and the macrophages to evaluate the anti-IA effect in vitro. We can see it inhibited the cell viability in RAFS cells, and these nanoparticles treated for 24 hours and irradiate with NIR laser for 5 minutes remarkably suppressed expression of some inflammatory cytokines secreted by LPS-induced macrophage and RAFS cells, but increased the expression level of interleukin-10. And it can also regulate the apoptosis pathway, NF-kappa B and NRF2 pathway to show the good anti-IA effect and inhibited the MMPS-RS in LPS-induced RAFLS cell and macrophages. And finally, we did the in vivo experiment of anti-IA effect of these nanoparticles. This is the scheme of pharmacodynamic action and the mechanism of HRPS nanoparticles against RA in vivo. This picture showed the targeting ability of the HRPS nanoparticles in POL and the main organs of ARIS. It means adjuvant induced arthritis race. You can see the fluorescence intensity was the highest in the liver and the canine of rats in the PBS group. Compared with other materials, the fluorescence intensity in the POL was higher than that in the liver and the canine of rats treated with HRPS nanoparticles. This picture showed HRPS nanoparticles inhibited the post-veiling in ARIA rats. It also improved the ARIA rats life quality. Then histopathological results showed that HRPS nanoparticles could efficiently protect the joint of ARIA rats. It inhibited the infiltration of inflammatory cells and synovial hyperplasia and prevented the narrowing of joint space and pendant formation. The radiological results showed that HRPS nanoparticles combined photothermal treatment inhibited slight bone erosion and articular space stasis. Okay, after laser irradiation, the temperature of the rate pole in the HRPS nanoparticles was up to 53.6. And it also reduced the expression inflammatory cytokines in serum and increased the expression of interleukin-10. The immunohistochemistry and fluorescence showed it inhibited interleukin-6, interleukin-23, and interleukin-17 inflammatory cytokines in the POL tissue. It regulated the apoptotic and the NRF2-H01 pathway and inhibited the NF-kappa-B pathway in the POL tissue of ARIA rats, and also inhibited JAK2 status 3 pathway and MMPS in POL tissue of ARIA rats. And we also find it can protect the liver and the canine in the treatment and reduce the inflammatory response, improve the anemia, inhibited platelet production, and improved the blood coagulation.
There is no time remaining.
Okay. Finally, we find that we did some okay. The final we used we found it can regulate the genes and the metabolism in the standard pathway of HRPS non-pelix group and the model group. Okay. That's all. We thank the Dr. Wang Wei's group and Dr. Liu in Hunan University to give us the support. Thank you.
Thank you so much, Professor Patrick. Actually, we have no time remaining, so I would request all those who would like to ask questions to write in the chat box. Thank you so much.
Thank you.
I'd like to introduce our next speaker, Dr. Wasim Ashraf. He is Assistant Professor in Department of Pharmacology, Faculty of Pharmacy, Housing Zakaria University, Multan. He has received S&P scholarship from NUST Islamabad and also a 90% HEC overseas scholarship from HEC. His research interest is pharmacology, epigenetics, neuroscience, molecular genetics. His title of presentation is Combination of Levetiracetam,
Levetiracetam. It's okay.
Levetiracetam, I don't know. With sodium selenite prevents pentynyl. I actually asked him to read his own title.
So thank you for your kind words. My name is Wasim Ashraf, and actually I'm presenting the work done by the MPhil students in our department in Pharmacology University of Multan. So the research is about. Can I? Okay. So the result that I'm going to present is actually an MPhil thesis that was done by our students in Pharmacology University of Multan. So it is about the combination of levetiracetam and anti-epileptic drug with sodium selenite, and it prevents actually the pentynyl tetrazole induced stimulation. It's actually an epileptic model that we use in our class. And we study different kind of behavioral tests in that project. So, okay. So the topic is about epilepsy, and epilepsy is one of the most common condition of the brain. Actually, it is characterized as the hyperexcitability of the brain because of the imbalance between the inhibitory GABAergic neurotransmission and the neurostimulatory glutamatergic neurostimulation. So around 50 million people are affected globally, according to the WHO fact sheet, and 80% of those people are from the middle or low income countries. And if you look at the scenario in Pakistan, around 2.2 million people, around 1% of the population is suffering from epilepsy. So, and in epilepsy, there are different kind of comorbidities. Sometimes the brain injuries, damage to the brain, some kind of a cancer or a tumor in the brain, they precipitate epileptic conditions. And similarly, sometimes because of epilepsy, there are different kind of comorbidities. So both sometimes they are fueling each other, and the condition becomes severe for the patients. So if you look at the different comorbidities associated with epilepsy, these are the depression and anxiety, migraine, ADHD, deficits, memory, impairment in the memory learning. So we try to address these kind of comorbidities in our project. So First, we check out different kind of anti-epileptic drugs that are currently available and are routinely used in the clinical practices. So there are different drugs. For example, these are the drugs that are acting on the GABA transmission. They are kind of potentiating it. So, for example, pregabalin, tiagabalin, benzodiazepine, and barbiturate. And there are different kind of other drugs that are kind of inhibiting the excitatory neurotransmission like that. Besides that, there are different drugs that are acting on the sodium channels and some are acting on the calcium channel as well. But we are basically interested in the levetiracetam that is basically acting on the SV2 protein, the synaptic vesicle protein that is actually involved in the release of the neurotransmitters, the synaptic. So besides levetiracetam, we were also interested in selenium. Selenium, it was actually studied that the serum levels were found low in people and the patients suffering from intractable epilepsy. So the idea was to provide more selenium to test the increased level of selenium in epileptic models in rodents. As selenium is important, it is involved in various selenoproteins, glutathione carboxylase, that are providing us an antioxidant stress pathway in our system and the TRX system. So the model that we used in our study was PTC, model. Basically, the pentylene tetrazole, that is basically a GABA A receptor antagonist. It is injected into the mice in a subconvulsive dose. In small doses, it is injected into the rodent models, and gradually, because of the pathogenesis induced by the pentylene tetrazole, the rats or the rodents become hyperexcitable and the disease is reduced. So the PTC injections are usually done on alternate days, and with the passage of time, the disease is induced. That can be on their backs. Initially, the mice will be immobilization or domination. Gradually, they will develop some kind of hyperexcitability evident by myoclonus seizures and rearing, and then full tonic-clonic seizures. So, because of these conditions, we can have a Gleason scale as well, on which we can characterize like how far the disease is developed or how far the pathologies are induced or pathogenesis has been there. So this is the study plan that we had in our project. So we had different mice that were taken, gas that were taken. So 30 milligram, that is a subconvulsive dose of PTC, was injected intravenously. And besides that, the rodents were injected with the normal saline, diazepam, that is a well-known anti-epileptic drug as well. Then levetiracetam, drug that we were already testing, and the sodium citrate alone at 0.25 milligram per kg dose and 0.5 milligram per kg dose. And then we use also a combination of levetiracetam with a different concentration of sodium citrate. And after taking, like, we analyze the behavior of the animals by different tests. We use open field test, light and dark test, and elevated plus based test for the anxiety. And then for the mapping and learning, we use Y-based, known-object recognition test, and the Morris Bolton based test. For to test the behavior of animals, especially for depression, we use the sucrose preference test. And besides that, then we did a biochemical assay from the brain, homogenate, isolated from those animals. So first, like, we analyze the development of the disease by the seizure score. Like if the animals were having seizures, then the seizure scores were increased. That is actually based on the racial scale that I described earlier. So as you can see in the PTC controlled rats, after killing, like after reaching 11 injection, the rodents were having seizures and they were having the myoclonic, tonic-clonic seizures. But like when we injected them with diazepam and levetiracetam, the disease was not so there. In some cases, like we were having like 1 or 2 cases where we would have some jerky in the rodents. Similarly, we also tested that with the sodium cyanide. There were like some of the animals that were having seizures or they were scoring high on the resistance scale. But when we co-injected with the sodium cyanide with the levetiracetam, they were like most of the animals were in the normal conditions. So this observation hinted us like sodium selenate along with the levetiracetam prevented the onset of the disease in these rats. Then we tested the behavior of the animals in open field test. In open field test, actually we introduced the rodents in a box in an open field, and we see like their preference for the periphery or in the central lobe. When the animal or the rats are in anxiety, they prefer to stay in the peripheral lobe. So as you can see, like when they were in the they were treated with a PDC lobe. So in the clinic, they were spending more time in the periphery. There was less entries in the central zone. But like when they are treated with any kind of anxiolytic agent such as diazepam, then they start to move around and they are comfortable to spend some time in the central zone. So by this test, we measured the entries in the central zone, time spent in the central zone, and the total distance traveled, like how active and how mobile they were. So by the co-injection of the sodium cyanide and levetiracetam, we can see that the mice were confident enough to spend some time in the central zone, that the entries in the central zone was also increased, and the time was also increased. And similarly, they were more mobile as well. They were like moving, and the line crossing, because we had different zones, we were different zones in the grid, so the line crossing were also increased. So in the next experiment, we did light and dark wash. So the rodents have inherent ability to stay in the dark chamber. They have inherent preference for the dark chambers, and they prefer to stay in the dark areas. So when they are in stress condition or they are in anxiety, they prefer to stay in the dark chamber, and then they don't go out in the open or the light chamber with the light. So again, the mice that were injected with PDC, or they were having the epilepsy, they were spending more time in the dark zone. They were like less time spending in the light zone and more time in the dark zone. But when they were treated with diazepam, there was increased time spending in the light zone. And similarly, with the levetiracetam, they were increased. And gradually, with the dose-dependent effect, we observed in the sodium selenate as well that they were spending less time in the dark zone, and gradually with the levetiracetam sodium selenate, they were having increased preference for the light areas. That shows that because of these combinations, it was having some kind of anxiolytic potential in it. Secondly, after that, like we also observed the behavior of the animals in the elevated dust maze. It is actually a maze design which has some closed arms and some open arms, and it is from the floor or from any kind of area. So the mice or the rodents have more preference for the closed arms especially when they are in stress or in anxiety. But when they are in normal condition or behavior, sometimes they go out into the open areas. So again, we observe the number of entries and the number of time spent in the open arm. So as you can see in PDC model, there were less time spending in the open areas, and there were less entries in the open areas. But with the treatment with the diazepam, where the anxiolytic agents, the animals were spending more time in the open areas, and especially with the levetiracetam and sodium cyanide, we also saw the same behavior. So overall, these three tests show that sodium selenide and levetiracetam together can have the anxiolytic potential, and that can be helpful for the patients of Rheumatoid epilepsy as well. So after that, we move on to the specific tests that were related to the memory of the rodents. So we had Y-maze. So initially, the rodent is trained like there are three quadrants at 120 to each other. So one is usually closed, and initially the mice are trained and they can explore any of the two quadrants. So when they are on the day of test, like the third quadrant is also open for them, and then the mice or the rodents or the rats have the tendency to explore the unexplored area. So If they are going into the unexplored area, it means that they have the memory of these two areas and they are exploring the new one. So by this spontaneous alteration, we can see like if they are exploring the new area or not. So you can see that with PDC, they were not exploring the new area. They were not having the memory of that. But with the sodium selenate co-injection with the levetiracetam, they were exploring the new areas as well. Then we also check the memory through the novel objection recognition test. In this test, actually, the mice is familiarized by some kind of stationary objects in its vicinity. It gets used to it, and whenever like you put a new object, it goes to it and explores it. So by the help of this discrimination index, you can see like if they are aware of the new object around them or not. So in this way, like we can see that with the PDC control, they were able to identify the new or novel object. But and similarly, same was the case with sodium selenide alone. It was not so much efficient, but when we co-injected it with levetiracetam at 0.25 and 0.5, so again, the rats were able to identify the new objects. Similarly, we also observed the memorings of the rats in the Morris water maze test. Actually, like mice are put in a water maze, and they are given some proximal clues inside the box and some distal clues as well. And then they are trained to reach a quadrant or platform in the water. So initially, like for the first 2 days, this quadrant is visible to them, and it's usually at an elevated position. But after the 2 days of the training, it is the water is turned murky, so, and the platform is submerged into the water, so it's hidden. So you can see like how quickly they're able to recognize that platform and they're able to reach that. And on the day of the experiment, the platform is removed there, and we just analyze like how quickly the rat is going to that area and if he is trying to identify that platform or not. So as you can see, like in the number of entries, like in the visible patterns in the control group PDC, like they were having like more time to identify the platform, and you can see that they were moving around to find the platform. But with the diazepam, they were quick to find the platform and reach to the particular target. And when they were injected with levetiracetam and the sodium selenide, they were reaching to that place very quickly, and they were almost taking the least distance to that place or platform. So now, like if we look at the results of the 6th day of the probe day, when the platform was removed from there, so you can see that the entries in the platform region were like significantly increased in the levetiracetam and sodium injected rats. Like they were going to that area, they were trying to identify or find the platform and reach there. So by this, like we can reduce that. It helps to overcome the memory impairment in the rats. In the end, like we also analyze the anhedonic behavior in the rats, like especially when they are not or they are unable to experience the reward or the pleasure feelings. So the rats are basically supplied with the two kind of fluids, one with sucrose and one with without sucrose or just the normal water. So the rats or the rodents usually have the inherent preference for the sucrose or the sweet things, so they tend to drink more of the sweet water. But if they are having a disease, they lose that feeling. And when we were treating them with the levetiracetam and sodium selenate, they were able to retain their reward feeling as well. So in the end, like we isolated the brain homogenate from these rodents, and we tested them for different kind of antioxidant activities. So first of all, like we checked the MDA levels, and they were increased because of the oxidative stress in the PDC waters, but the levels were not so increased in the levetiracetam and sodium selenate. And similarly, the levels of the SOD, the catenase, and the glucose peroxidase were increased in the sodium selenate and the levetiracetam co-injected mice, which shows that together these molecules can prevent the oxidative stress release. So if we can conclude from these results that the levetiracetam and sodium selenate hinders the PTZ-induced epileptogenesis that we can see through the resting scale. And then this combination also ameliorated the anxiety and the memory impairment and the depression-like comorbidities in the epileptic molecules. And presumably this effect was exerted through the antioxidant potential of the sodium cyanide and the SVT protein function of the interference of the levetiracetam. So this is all about the project, and in the end, I would like to thank the MPhil students of Abi and Bernard and the PhD students Sana for helping out them in the experiments, and Dr. Imran for introducing me to this new field of science, the neuroscience.
So much, Dr. Singh.
Yes.
Respected speaker, you are vast and depth research about the behavior of birds. Sir, my question is concerned that the birds present exist species are more larger than the cat. Cat are just astonishing.
Okay.
Do not attack. In Karachi and Red area,
There are some mice. There are some rats like that.
What are the behavioral change and the poisons, great dealing poisons to thrown inside? Their rate is not to be tried or inhibited to kill, just to immunize their, just like zinc sulfate and Russian is very high, and just to stick your mustache and spread their in platter of different areas of food open food, spreading the poisons. What are your opinion? Because you are researchers of it, keep observation of it in this regard. Please, thank you very much.
Okay, I will try to answer this question. I'm not really the expert in that field, specifically related to the toxicology. So rats have evolved, and like they are getting smarter day by day, we can say that. And the wild type rats are certainly different from the animals that we have in the control environment, and they can predict differently as well. So they are having experience from different kind of things in our environment. And as you can see that they have the potential to learn and memorize few things. So if they get familiar with something that is harmful for them, so probably they can retain that memory, and then in the next time they will try to avoid that exposure. And in this way, like probably they can escape the kind of poisons or the way that the poison is introduced to them. So probably like we have to be more innovative in our killing strategies by designing some new techniques or new poisons or more effective ones to treat, to kill them or to prevent the infestations.
Thank you.
I have a question. Yes. With your very nice presentation. The behavior test that is for almost like several neurological diseases.
Yeah.
The similar kind of behavior tests are effective when we talk about the behavior. So, for example, in Parkinson's disease, the similar kind of tests are
Yeah, exactly.
for the behavior test. So, we need some specific behavior test that is among all of that, which is more related for the epilepsy.
For epilepsy, we would ideally like what we are trying to do for the epilepsy in our lab is like to have an EEG recording as well, so that we can have a look onto the firing potential of the animals as well. And then we with the recent scale, like how often like we can see the jerking, whereas how often we can see the tonic seizures or the tonic seizure. They give you like more idea about the epilepsy rather than the other tests which are specifically used for the memory impairment or the depression or the anxiety. So these things like we usually use for the epilepsy, and the other tests that I mentioned we use specifically for the specific conditions like for memory impairment, for the depression, or for the anhedonia behavior. So we use different, and like we can have more reliable data by EEG in terms of the epilepsy. Like we can see the electron firing potential over there, like how the brain electrical activity is going on, and then we can correlate with their video that is usually we sync with them, and then we can be more sure about the epileptic behavior or the conditions over there.
So you have a plan to
On these lines, In fact, like Dr. Ahmad is here, and we have already started to work on these lines. We have already started, like we have a system like around 16 channels where we can monitor like different animals simultaneously for the EEG recordings. And besides that, like we are also thinking to integrate, and we are planning to integrate the molecular studies as well, where we can study specifically the genes related to the epilepsy as well, to see like if there is a differential gene expression in the normal mice or the kennel mice or the normal rats or the kennel rats, so we can see that as well.
Just more to add, exactly first, they have anxiety of the attack. They are supposed to say that people have had an attack. So anxiety is all the time for
There are
depressive all the time for and the memory compromise the part. So it's a comorbid situation.
yeah.
Do you have a plan the form from
We would love to, but actually, like right now, we don't have the facilities in our. We are trying to procure some kind of rats or animals which can help us in these kind of studies, but you know that it's a little bit tricky and it's a bit difficult to obtain at the moment, expensive as well. So we are trying to, but let's see. We will certainly look for your support as well in this regard. Thank you.
Okay, so this was the last session.